Some patients are not fit for LASIK and say they still want to remove their glasses. So, and what do you think happens in that scenario?
Of course, I mean, quite a few patients, we've all seen such patients.
Right.
There is a cutoff. And if the patient is not fit for it, we really can't give them the option of that. But yes, we, according to the pentacams and according to other tests which we have to do, we can do a procedure called as ICL. Okay, this is a phakic lens which we place inside the eye so that the patient is more safer, the cornea is not touched, and the patient is happy. It's a very safe procedure for removal of spectacles. But that also has a criteria. We need to see, and all those criteria can be taken into fact by the pentacam test. So we'll have a clarity of that, and there are patients who aren't fit for that also. So then what do? We just tell them to wear either spectacles and go for contact lenses.
Right.
That's the only way to go ahead. What do you feel?
There are certain patients who are not fit for LASIK, be it their very high number like -15, -20, or even plus numbers as well. But then again, there's another modality of ICL. We put the lens inside the eye with their natural lens intact.
Yes.
So that removes the number, and we've done patients up to -20 as well and higher numbers which are treated with the ICL.
So the main thing about ICL or how to choose, it comes back to the same thing that as a specialist, the specialist will sit and discuss all the points with the patient. You know, the treatment and the management has to be customized. And that's
Right.
how I feel we all take it ahead. We
Right.
can't do a blanket therapy that one size fits all. We cannot do it.
Absolutely.
So, patients have to understand that even to date, we have a lot of options, modalities of treating, but that does not mean that all options fit you. It could be that the highest, the best of the most advanced surgeries is not suitable for the patient who can afford everything.
Right.
And that is what the patient has to understand, which sadly I feel patients don't understand.
Right.
I have seen a lot of patients who are quite upset when we tell them you're not fit for this, you're fit for this.
Right.
I mean, I don't know if you've seen it, but I have had a few of these patients.
Absolutely. Yeah. So because they haven't heard about the treatment, they don't know about the treatment. So first thing I do tell the patient is to go back home, research more about it, read more about it, and get to know more, and then ask me questions.
And factful reading, not the YouTube videos which are just randomly put by patients. No, that's not facts. You need to get into the depth, and if you have a doubt, I feel, go back to take an appointment again, discuss with the specialist. He or she'll be willing to actually sit and talk it out with you. Because after all, it is for the patient's eye.
Absolutely.
The patient has a right to know that. And I mean, both the platforms are beautifully safe, but criteria are different. The patients who are undergoing it is also entirely different spectrum. And the patient has to sit and discuss and understand the options given to them by the specialist concerned.
Right. And every patient and every eye is different rather.
Yes.
So maybe some patient with one eye which is suitable for LASIK and one eye which is not suitable.
This has also happened. Yes,
right.
Yes,
so we've got ICL in one eye and LASIK done in
Absolutely.
for the other eye. But we want to do what's best for the patient, what's safest for the patient, and would not harm the patient in the long run.
Correct.
Right.
If we have to know about the difference between ICL, LASIK, we understand that both the class of patients are there. We also know that the safety net for both is very good, and we also have to understand that there's a different testing, different understanding that the patient has to also undergo all the paradigms of the complications related, the side effects, as well as understand the preoperative. But apart from that, the patient also has to understand what is suitable for his eye. That is very important. It's not that your XYZ friend or your colleague had this kind of procedure, but that may not be suitable for you. So it's important to understand the difference between the two major platforms. It is also important that maybe one eye for a patient can undergo ICL and the other eye cannot, or the one eye can undergo LASIK but the other eye cannot. So the patient has to know that these permutation combinations, pluses, minuses, whatever it is, has to be discussed with the specialist, and the entire discussion has to be done on 101. It is not a tailor-made thing, it has to be customized to the patient.